In this video, we will discuss about abdominal obesity or the middle fat. Abdominal obesity is associated with what is known as metabolic syndrome. Metabolic syndrome is defined as a cluster of at least 3 out of 5 risk factors. These risk factors include abdominal fat, high blood pressure, high triglycerides, which is a kind of fat, low high density lipoprotein, which is a kind of a fat which helps prevent heart disease, and insulin resistance. Abdominal obesity is a marker for dysfunctional adipose tissue which secretes inflammatory chemicals leading to a host of health problems such as heart disease. These health problems can occur even if you are in normal weight range based on BMI measurement. How to measure abdominal obesity? Waist circumference is an important measure of abdominal obesity, while BMI is used to measure obesity in general. It measures what is called central obesity or abdominal obesity or visceral obesity or male type obesity. Waist circumference of more than 40 inches in men and 35 inches in female is considered high and indicates higher risk of heart disease. There is a higher risk of breast cancer. In Asians, waist circumference of 35 inches in men and 31 in female is considered abnormal. In Asian population, waist circumference is more important than BMI-based risk, even if BMI is in the normal range. Higher waist circumference is an independent risk factor for death, even when adjusted for body mass index. What are the health consequences of higher waist circumference or abdominal obesity? Abdominal obesity is associated with higher risk of dying. There is a higher risk of heart disease, diabetes, high cholesterol, high blood pressure, higher risk of fatty liver. How to measure waist circumference? Measuring at the level of umbilicus or the belly button with a tape is the best way to measure it. Waist circumference alone is a better indicator of obesity compared to waist-hip ratio. What are the causes of belly fat? One cause is poor diet, refined, highly processed food rich in carbs and low in protein, excess alcohol consumption, sedentary status with little exercise, too much stress causing excess cortisol production which cause calories to accumulate around belly as fat. Poor sleep is another risk factor for belly fat. Also, genetic factors are important. How do we treat abdominal obesity? All measures discussed in obesity and weight loss that I discussed in the previous video apply. Please refer to the video on weight loss. Best way to lose belly fat is through a combination of weight losing strategies such as dieting and exercise. As far as the diet, eat a whole food, complex carbohydrate containing food with a lot of fiber and avoiding sugary drinks, refined products. As far as exercise goes, regular and consistent exercise can reduce abdominal fat and body composition independent of weight loss. Reducing fat around the abdomen is more important than the overall weight loss or decrease in BMI, especially when treating patients with metabolic syndrome. Moderate intensity exercise, 30 to 60 minutes a day, is important. Combine it with strength training as well. Prolonged physical activity seems to help some people in some studies. About 400 minutes of walking a week helped reduction of visceral fat according to a study done in Portuguese postmenopausal women. 10,000 steps a day will be ideal. High intensity training programs helped in some studies. Jogging 1 minute alternating with 3 minutes of walking helps with weight loss. What about sit-ups? Just doing sit-ups can strengthen abdominal muscles, but it would not help visceral fat, contrary to popular belief. So in conclusion, abdominal fat is associated with a host of health problems such as metabolic syndrome. Losing abdominal fat using a combination of diet and exercise can reverse metabolic syndrome and the health problems associated with it, such as diabetes and high blood pressure. Thank you for watching this video.